All right. Well, welcome. And we're here with Dr. Reid Robinson and Stephen Thayer, who's also he's a PhD psychologist, excuse me.
Psychologist, yep.
Both of them have some just rich experience in psychedelic medicine, particularly utilized in a therapeutic sense, and mostly surrounding ketamine. So we're going to get into that, but we're going to globally talk about psychedelics in general and just the future of what mental health treatment looks like. You know, it's changed so much in the last 10 years. Before we kind of dive into that, I first met Dr. Robinson, I don't know, it was about a year ago, and we have a friend in common, and she introduced us thinking that Dr. Reid would really enjoy a product that we make called Zen. And I think that was accurate, would you say?
Yeah, that was quite the brunch meeting we had. I didn't know I'd be experiencing some intranasal hape mid brunch. So that was memorable. It was a lot of fun.
Yeah, I remember you had a lot of your family was there, your brother and your son, and there was a few people there, and we were passing it around, and we were just really enjoying. So there's a burn that happens for those of you watching that don't know what this is. It's a Zen spray, which is based on an Amazonian herbal nasal spray, and you get a burning, but then there's this afterglow. So we were all enjoying this afterglow and just having a nice conversation around breakfast there in Utah.
Yeah, my son Dallin had come with me. He's 21, and he's like, so that's what business lunches are like.
That's awesome. So Reid, why don't you maybe let's start with just giving a little bit of history as far as how you got involved with ketamine. I know you used it initially as an anesthetic in the hospital, and then you started to do some research. And I'd love to hear just a little bit about how that came to be.
Sure. Yeah, I'd be happy to. So I'm a psychiatrist focused nowadays on the therapeutic use of psychedelic medicines and the therapy that goes with it. But from the beginning of my career, I've focused on helping individuals suffering from mental health conditions, especially where traditional treatments have failed, including studying new medicines and helping people access them. So I started out doing clinical trials from the get-go, and I was maybe a couple dozen clinical trials in when I encountered ketamine. This is a couple years ago. And I got to admit, I was a bit underwhelmed by the Me Too drugs coming down the pipeline, that might be a coin toss at best of who they were going to help. And then along came this anesthesia medicine, in the literature anyway, showing its rapid antidepressant effects from a non-daily medicine that also has psychedelic properties. So I was asked by Johnson & Johnson, who owns Janssen, to do a study of IV ketamine for treatment-resistant depression, and got to sit with people through their journeys and asked them questions before, during, after, and I was just blown away by the transformation that was happening. And so I dove in from there. I started giving it clinically back about 10 years ago.
Mm-hmm. Yeah, I was at your clinic not too long ago, and you were so kind to have me in, and I even joined one of your clinicians' meetings, and I was able to watch your staff work with people, and it was just incredible, the level of care and the stories coming out of the patients, coming from some, very refractory conditions where they've tried pretty much everything and then came to your clinic, and they've had these journey experiences with ketamine, and it just seemed to open something up for them to allow them to process some of these subconscious issues that were plaguing them, right? So I think we should really dive into that and like what's really happening there. So, mental illness in general, I think, is poorly served, especially pharmaceutically. So I haven't found it really a huge challenge to find people that have failed your traditional conservative therapy, because there's not really a lot of great answers. Would you agree with that?
Yeah, I think it's always been striking to me that one in every, I don't know, 6 or 7 Americans takes an antidepressant medication every day. And while sure, they're helpful for many, the response rates, like I was saying, leave so many suffering. If you look at the STAR-D study, a classic antidepressant study, it was about a third response each time you try a new medicine. That's, that's not that great. That's not that great, to be honest. But Steve, what do you think? What's your perspective?
Yeah, I mean, so I'm a clinical psychologist. I come at this from sort of a different avenue than Reid comes at this as a psychiatrist, right? As I'm not a physician, I'm a psychotherapist. And I like to be really obnoxious around the terminology, that a person failed a medicine or that they didn't respond to treatment. I feel like the medicine fails the person. The person doesn't fail the medicine. And I got into psychology because I was really interested in just human consciousness and the human condition and the ways in which we suffer psychologically. And I quickly became disenchanted with what we can do for people, both from a medical perspective, giving them medicines and treating them, treating the biology of their body, but also from a psychotherapeutic perspective. So yeah, I started my career as a psychologist in the Air Force, and it's a very regimented kind of thing, as you might imagine, being in the working for the Department of Defense. And they had strong opinions about the way you help people. I did learn some really interesting ways to help people who were struggling or suffering, but it just wasn't enough. So I eventually developed an interest in psychedelic-assisted psychotherapy, and it was born out of my sort of disenchantment with how much we can help people. And there's no such thing as a panacea for the human condition, but there's something extra that medicines like ketamine and other psychedelics do, which we can get into, that I think not only can help people who've been, diagnosed with a mental illness, but also people just struggling from what one might call ordinary human struggle.
Right. Well, I practice a technique called functional neurology here in Florida, and we use different exercises and activation to the brain to help with vestibular disorders or TBIs and so forth. And one of my instructors, his name's Dr. Carrick. He's actually very well known for teaching this work. Once in one of his classes, he said that you can't give a pill to someone so that they know what a strawberry tastes like, right? You once you have a strawberry, that's those pathways are there for the rest of your life. You know exactly what one tastes like. And I think with pharmaceuticals, I don't see them ever really getting there because it's a global effect, right? So you're affecting the brain globally versus with the psychedelics, the way I understand it is it deals with neuroplasticity. So there's actually the way that the brain's wired, right? Versus just the overall general chemistry in the brain. So maybe you could speak a little bit to that and what your thoughts are on that.
Sure, I could take a first pass at that. That's one of my favorite mechanisms of psychedelic medicines, including ketamine, including Spravato. There are, peer-reviewed journal articles in support of this. This window of neuroplasticity that opens up for classic psychedelics and ketamine, and there's some fun analogies that we like to use, but one that comes to mind is like, our brain is like, say, as the weather warms up, I'm thinking about getting on a mountain bike, right? Getting on the trails. And as you travel a trail, you make these indentations, these ruts in the road, so to speak, where the next person coming along slips into that. It's like how our brains work as neurons that fire together, wire together, and these signals travel more and more down these same pathways. But when you take a psychedelic medicine, it wipes that clean. So there's a blank slate and you can consciously choose the tracks as you chart your course down the mountain. And personally, experientially with psychedelic medicines, I noticed that when I come back from an ayahuasca ceremony, I feel like my habit loops have been rebooted. Like I can just choose without the same tug of war against my habitual neuronal patterns.
You know, one of the things I reflect on, and that was a great explanation of neuroplasticity. Oftentimes I'll talk about people skiing down a mountain, but it's really the same theory. The neuroplasticity aspect of how this works, oftentimes I think a lot of these mental illnesses are resulting of people either stuck in the past or the future, right? They're not in the present moment. And, you know, I see depression as being, you know, stuck on the past. PTSD, you know, it's past, right? Where anxiety is more fear of what might happen in the future. And when we get ourselves in the present moment and we're curious, you know, this is a more exciting, happier, it's like a child, right? So do you feel that the psychedelics are putting us more in a present moment, and that's how they're possibly creating these neuroplastic opportunities?
I can speak to that, John, because you hit on something that's really important for what I think healing from a mental illness really represents. If we are valuing neuroplasticity, it's because mental illness or, you know, psychological problems are a result of cognitive or conscious or neurological rigidity, right? We think in just one sort of way or react in one sort of way. It's almost like a learning disability. We're having a hard time updating our beliefs about the world or about ourselves based on the data because we're stuck in either that's because of trauma that's wired us a certain way, or because, like you said, we're worried about the future, but it's not curious and open about the present moment. And that's two things that psychedelics, I think, do really well, is that they put us in a mental and emotional state of curiosity, openness, you know, and also anchor us in the present moment. And there's some things that they do in the brain that I can occasion that sort of hyper presence, that mindful Buddha presence, that maybe Reid can speak to. But I think that's two of the things that make them so powerful as a tool for healing is they increase curiosity / openness and then anchor you in the present moment in a way that's difficult to achieve otherwise. Not impossible. You know, you hear stories about Zen masters and lifelong meditators who can achieve similar neurological states. But I think that's one of the things that makes them so valuable as a healing tool.
Well, it makes so much sense to me if you can get yourself into a really now moment, then that whole idea of leveling the playing fields where you can kind of navigate off of that path really makes a lot of sense. It's almost like a window of opportunity opens up in that now moment for patients. And we often get so stuck in loops, you know, thinking about the future, you know, the predictable future and the familiar past. And I actually just got back from a Joe Dispenza week-long meditation retreat. And he speaks on this quite elegantly. We literally had 2 days where we woke up at 4 a.m. and meditated for 4 hours.
Wow.
So, you know, talk about getting like really rooted in the present moment, and the amount of joy and calmness and just overall happiness is really quite remarkable with that type of activity. Now, when you're working with patients there at Cedar, are you guys also utilizing a lot of meditation practices with your clients?
Yeah, we will. I mean, that's where the magic meets the road in terms of psychedelic transformation, is in what you probably hear a lot these days when people talk about psychedelics. It's in the integration. It's in what happens when you get back into day-to-day life, and what new habits, practices, things do you bring into your life as a result of these experiences to make them stick. Otherwise, there's a risk of it all just snapping back into place. So we'll use meditation in a number of ways to get ready for a psychedelic experience. I do think that's one of the most crucial skills to have going in, whether it's your first time or your 100th time. And we also use it to till the soil going into, say, a ketamine journey or otherwise, any psychedelic experience, to really unearth the right intentions and facilitate that state of openness. And then as a day-to-day practice, I think that's huge going forward.
Yeah, it makes sense. So it's you're giving people an opening, and at this point I should probably key the folks watching. We here at Advanced Rejuvenation, we also do ketamine-assisted psychotherapy, and you were really one of the inspirations for us to get involved with this, and that was one of the reasons I was out there at your office, is doing a bit of research and training, watching the master, so to speak. But the process of opening that, it's like, Jesus said, I can give you fish, or I can teach you how to fish yourself, right? So I think providing the journey is giving patients fish, but then I think the meditation, and then there's I think there's some other things that could be dovetailed into programs, which I'd like to kind of dive into a little bit. There's going to be maybe some rabbit holes we can dive into a little bit. But I've been over the last few months, as we've kind of delved into the using the ketamine clinically, I've started to kind of formulate this 3-legged stool. And I don't think that we've really talked about this at length, but I think I did mention it to you on a conversation over the phone. Is one of the legs is the vitality of the body, which is, I think the more healthy you are, the more you're exercising and eating right and things like that, you're able to have better mental health and be happier. And then having an understanding of the mind, where, things like we talked about, being more present in the moment and understanding how the mind wants to work with, worrying about the future or ruminating about the past. And so I believe another leg of that stool is kind of mastering the mind. And then the other leg of the stool is this profound spiritual awakening, this mystical experience where one can actually have an experience where they realize that there's something more to life, right? There's a higher power. And I would imagine, and I'd love to get your feedback on this with all the people that you've done this work with. Are you seeing a lot of people have this profound mystical experience? And is this a necessary component that you're seeing where people have even better results with their therapy, or is it not something that you feel is a huge importance?
I think it's huge, and we go for the gold in terms of trying to occasion those mystical experiences, and in bringing spirituality into the work, like transpersonal approaches to therapy, or assisting someone in their search for meaning, and in their because as they get beyond the self into that greater sense of oneness, unity, expanded consciousness, it can be absolutely game changing on someone's healing and recovery journey. And so, I don't think it's absolutely essential for the benefits of the medicine. If you look at ketamine, for example, it's a rapid antidepressant chemically. It has some benefits. We will bust it out when someone's in crisis and we need a potent anti-suicidal, antidepressant agent. But if we can go in with intention and openness and meaning, and use it to tap into that inner healing intelligence to gain insight about one's path forward, or to kind of gain a renewed sense of hope, then that's incredibly powerful, and the recipe for more lasting transformation, I believe.
Yeah, and we should probably be clear that we're not imposing a particular spiritual, transpersonal, or religious ideology when we're trying to help people in this way. We're acknowledging that these substances, like Reid said, they manifest a mystical, transpersonal type experience, and so we want to encourage people to explore that. sort of, I guess, through the filter of their own particular spiritual paradigms. And this is, to me, this is a really interesting nexus point, this where Western medicine meets maybe traditional healing practices, meets transpersonal spirituality. Because John, I like your three-legged stool analogy, and the spiritual transpersonal is a leg that I think has been neglected certainly by Western allopathic medicine. And it is something, I think, this is my opinion, it is something different than just mental health or emotional health. Spiritual well-being is connected to things that the two of you have mentioned already, feelings of meaning, something greater than ourselves. You could call it the Jung's collective unconscious, or you could call it God. Ultimately, it doesn't matter. It's something that is universal to the human experience that when we are disconnected from, and research bears this out, when we're disconnected from, we struggle, we suffer. You could make the argument that a lot of what is affecting the Western world right now are diseases of despair, that we've lost our connection to meaning and purpose. And lots of opinions out there about why that is, but it seems to be the problem. And I think it's part of what is fueling the excitement and the fervor of what we're calling this new psychedelic renaissance, as people are discovering that these medicines aren't shortcuts, but they are powerful tools to help us reconnect with the transpersonal or the spiritual or the numinous, the meaning of our individual lives.
I without getting too woo with this conversation, there was something that Joe Dispenza said in his seminar last week, and he was referencing a study where a scientist was looking at an egg, and he noticed that on the head consistently there was a positive charge, and at the tail there was consistently a negative charge. And what he found was that this was creating a magnetic field that represented the actual outside of the egg. And the researcher concluded that it wasn't the biological organism creating the field was actually creating the biological organism. So what he teaches that there's something called the quantum field, which is this mystical place that I think a lot of us go with psychedelic medicine, where it's unified, right? We're all one, and people feel like a sense of love. This is this near-death experience that we hear a lot of people talk about. And, it's related to DMT and the pineal, and there's a lot of interesting things that we could talk about there. But I think what's interesting is that when someone's opened up to this, it's like you get it, but you can't really fully describe that I got it. It's like you understand something at a level that seems to calm you down a bit, seems to make you feel more connected with other people, makes you want to be nicer to other people, right? It's like there's just a change that happens. Personally, I've experienced, but I've also seen that with a lot of our patients as well.
It reminds me of I heard this quote from Neil deGrasse Tyson once, after talking about this quantum field concept and, the spin of electrons and what's beyond that string theory. And he says something like, I guarantee that if you were depressed after learning about this cosmic perspective, you started your day with an unjustifiably large ego. Because it's humbling. It's like Carl Sagan's pale blue dot discourse just puts me right in my place in this vast cosmos, in awe and wonder and feeling kind of unified with each other, with plants, animals, with our planet. But yeah, I like what you said about science and spirituality. For me, are one and the same. Like science is trying to catch up and describe things, but the way we understood it, with electrons whirling around a nucleus, it starts to break down. So we have these more recent theories of everything, like string theory, saying that all these fundamental particles are really just manifestations of one basic object, a string, like a point. And,
Mm-hmm.
it's this string that can oscillate in different ways. And if it oscillates one way, it's a photon, another way, it's a quark. And so we're all really made of the same stuff. We happen to be vibrating in different directions, making us appear as that matter. I like your egg example, because I think that's a good way of putting it. We are literally, one in these kinds of ways.
And, for people watching this, to put this in context, if you're suffering from a mental illness, or you just want to be a healthier human being, you want to be happier, realizing that there's something that's a higher force, right? You want to call it God, you want to call it spirit, whatever you want to call it, higher power. This is creating matter. And so that means we can create whatever life we want. One of my close friends is Rhonda Byrne. She wrote the book, The Secret, and there was a big movie about it. Recently, she had another movie. And there's a lot of, spiritual leaders that have spoken on this subject, that we're in control of our life and our reality around us. And that's kind of what this does. And so kind of back to Joe Dispenza, he uses a breath. Have you been to one of his seminars before?
I haven't.
Neither one of you. Oh, you got to go. It was really amazing. He teaches a type of breathing where you're putting various pressures into the intrathecal, so into the cerebral spinal fluid, and you're doing the breath where you're moving it up the spine and aiming it up towards the pineal. And then there's like this pumping action that he teaches you to do with your breath. So there's intentionality behind a lot of the meditations where you're focused on the pineal. So there's a lot of emphasis on really waking up that pineal. And I saw a lot of people having these experiences that were very similar to what you would see in an ayahuasca ceremony, or, LSD, or, psilocybin, where people are having these profound spiritual experiences. And what they did is they're actually doing research with these cases, and they're measuring their blood. They've got a NASA researcher that looked at the blood of these meditators, particularly when they had these moments where, there's a brainwave change where they go into what's called a gamma brainwave, right? Where there's this mystical experience is what it's tied to. And what they found is there's this huge amount of exosomes that seem to be accumulating in the blood. So then they've taken the plasma of these different meditators, and one of the experiments they did is they took human epithelial cells, and they infected one group of the cells with, and the other one, they saturated them with the plasma, which is basically the blood from the meditators. And then they looked at it under an electron microscope, and the COVID virus couldn't even get into the cell with the meditators. So there's this effect. And, we do exosomes here in our clinic. We might take a patient that has like arthritis of their knee, and we'll take these exosomes from placenta and inject it in the knee, and realizing how stem cells work, where the stem cell goes to the injured tissue and it spews these exosomes, which are these tiny little vesicles that then shower the cells. And those vesicles are messengers that tell the existing cells and tissues to go into a youthful growth phase. And so what it seems like what's happening based on this NASA research is that by going into these experiences, some of the healing that might be happening might be our own body releasing these exosomes that are creating messages that are having profound changes in our health. So it's really exciting what they're doing out there, actually.
It's fascinating, John. And, as I listen to you, I'm thinking about, the people who are watching this or listening to this. I'm a recovering skeptic. I every time I hear something that sounds a little magical, or like you were calling woo, my initial gut response is, well, that's probably horseshit. And as I say, I'm a recovering skeptic. I'm hearing meditator blood cures COVID. And I know that's not the exact, assertion that the that the study is making. But I just want the listeners to, if they're feeling skeptical, to just open up yourself to the possibility that you don't understand exactly how the universe works. Neither do I. We don't understand exactly how the body works from a physiological perspective, physics perspective, and perhaps psychospiritual perspective. Ask yourself, how do you explain the placebo effect or the nocebo effect? When we can't see direct empirical reasons for why a person feels better or worse, except to say that they believed it or didn't believe it. And that had some kind of profound effect on their physiology. Something's going on there. And maybe we just don't have a precise enough measuring stick, a precise enough instrument to say, well, what's going on is it's epithelial cells, or what's going on, it's, magnetic charges, or it's microbiome, or whatever it is. The thoughts that you think, the feelings that you feel have a profound effect on your physiology, of course, on your health generally. So if there's something going on with a meditator that can heal you physically, even if we can't explain it perfectly, to the listeners, open your mind to the possibility that there's power there.
Yeah. Well, it's well put, and to your point, Stephen, I'm a skeptic myself. And so it's really hard to argue with some of the data they presented. And, the scientists being, do you remember when they sent one twin into space and they kept the other one, they had, to see for a year, this guy was orbiting the Earth, right? And they wanted to see what the impact would be for space travel, because they had these twins that they could compare. Well, this is the same scientist that did that research that's doing this. And it was the first time he'd actually been to one of Joe's conferences. And he was just blown away at not only the research he'd done before, but the data they were collecting right there on site that week. They were very, they're pretty blown away. So I think we're really just at the beginning of understanding how all this works. And I think that, for people watching this, realizing that there are things that are available that are, they're clinical. You guys have a great program there in Salt Lake City, and I think some surrounding towns there in Utah. And we're out here in Sarasota, Florida. And I know there's clinics that are kind of popping up throughout the country, because it works. This is something that definitely works. And so we're kind of circling back to neuroplasticity and the idea that the brain can change through the way that it's firing. Yeah. And this is something that we see in psychedelic medicines to have at the core of how they work. And there's a lot of different psychedelics available. Reid, I'd love to hear your ideas on what the difference is in, particularly LSD, psilocybin, and how ketamine kind of compares to those two.
Yeah, sure. Well, just to speak about neuroplasticity in general, if we want to peel away layers and go a bit deeper, one theory or framework I like comes out of Imperial College in the UK. Carhart Harris and colleagues, called Rebus, or Relaxed Beliefs Under Psychedelics. And they get into this kind of neuroscientific cognitive model of the ego, where our brains don't really like uncertainty. So they predict upcoming sensory input that they call priors or prior beliefs. This is essentially an extension of that idea that our core unconscious beliefs govern a lot of what we do. And so these get layered on top of each other. The higher levels send predictions down the hierarchy, the lower levels bring sensory input up. And when they don't match, the model either updates its prior information based on new sensory or ignores them and keeps its tightly held prior beliefs. When you get a blast of, say, a classic psychedelic, 5-HT2A receptors hit, boom, a rush of serotonin. It's they call that heating up the brain in this Rebus model. So psychedelics relax the weight of these tightly held beliefs. They heat up the brain, increasing plasticity, weakening the influence of all these prior beliefs. And as the brain cools, the hierarchy reforms. And it can be in a new configuration. And this can explain how changes can be lasting or persist. And so where there are conditions with too rigid of thought patterns, like you were saying, all the worrying about tomorrow, overthinking what's coming or something we said, maybe obsessive compulsive patterns, over control, disordered eating patterns. So disorders that rest on these rigid high level priors, when we melt those with psychedelics, you can get some dramatic changes. It takes a lot of work to make them stick though. So there are differences though in the way ketamine approaches this versus others, but I do think the concept is the same in general, giving the individual a timeout from that default mode, and then letting some new patterns emerge that hopefully we can work with the client and make stick.
A saying I really like is the quality of your life is in direct proportion to the amount of uncertainty that you can comfortably live in. Right. And so I think that really, to your point with is it the Rebus model?
Rebus, R-E-B-U-S. Yeah.
Rebus. Okay. But it sounds like a lot of the people just were very resistant to being in a curious now moment, really. They wanted to have that certainty.
Yeah.
And that's kind of, I think, some driving nature that a lot of us have as a default mode. Yeah.
Yeah, you can plot everything, in my opinion, on this spectrum of like chaos on the one hand, or entropy, to control, rigidity. And on that end, you might have the OCD, anorexia type conditions. On the chaos end, psychedelic states, but psychosis even, or towards that end, loss of control, where someone is stuck in a pattern of like addictive behaviors or binge eating or things like that, or can't get out of bed, instead of on the over control part, can't not get out of bed, can't let themselves break their own rules. And psychedelics have this way of restoring balance along this spectrum when things are far off onto one direction or the other. And so that's why when you take, like you were saying, there's a time component to many mental illnesses, but when you take that out of the equation, it does help explain why these tools can help with multiple different conditions. Some brains are too locked, some brains are too loose. There's balance in the middle. We're all swimming on this spectrum at different points and different times in our lives.
Yeah, I mean, this is just such a fascinating conversation. I know anybody watching this, if this is fascinating to you, which, I can't imagine anybody listening to this and not being, at least interested in the subject. If you're in the area of Utah, how would people find you?
Well, our clinical home is at cedarpsychiatry.com, and we're part of a bigger organization called NovaMind, based in Canada. So it's novamind.ca. You can find both me and Steve on Cedar Psych.
Excellent. Well, listen, you guys have been very generous with your time, and I think it's been a great conversation, and hopefully it's kind of opened up some curiosity for people, maybe getting in the moment and being curious at this during this conversation. So again, thank you very much. And, for those watching, you can reach us at advancedrejuvenation.us as well. And we have information about ketamine-assisted psychotherapy on our website. And again, thank you very much, Dr. Thayer and Dr. Robinson. I appreciate your participation in this conversation.
Thank you.
It's been fun to chat. We'll have to do a part 2 sometime.
Absolutely.